Well, thank you, and it's certainly an honor to share this table here with the leaders that have gone before and after me. I thought it might be helpful to give a little context of what happened during the couple years, because there was really some movement. Again, you heard a nice description, the shortage of nurses, and we come to the time when I entered into the leadership role, and quite a different situation. DRGs had arrived, and now we had gone from this extreme shortage into nurses graduating, not getting full-time jobs, and lots of concerns. And I, again, see parallels, as we look at history, we oftentimes can learn lessons for today. So we have read in the paper yesterday, I think, about the IU system, 800 layoffs. In Evansville, I'm on the board of one of the health systems, and we've had significant layoffs. So it's a phenomenon that's happening around not just Indiana, across the country. And my little editorial about that, it's not what I did at the point I was president, but maybe there was some similarities. It was to say, we have a cycle of shortages and oversupply. And while each of the dynamics of what makes that happen are a little different, and they're a little different now, nevertheless, you see a growing appreciation and a change of roles for nurses. And that was what, in fact, started occurring as the DRGs, as we moved into, again, another shortage, guys, actually about 88. So it was a short term shortage, oversupply, shortage. So for those of you who may have some concerns about some of the current layoffs, that may give a little context. So the job opportunities were a major area. We were concerned about continuing education, and this has been a long thread throughout our ISNA's history, and a lot of actually different ideas within our own association about whether nurses should be required to have continuing education. We're actually one of the few practice disciplines that isn't required, but Indiana did opt at the time when we were looking at it as a issue and taking a rather, I guess, neutral approach to it, decided that we would be watchful and we would support opportunities, but not go for the mandatory. Another hot issue, and I can talk again at the national level, because one of the opportunities we had as president was to represent, in part with other delegates, the state at the national convention, the American Nurses Association. And so the very hot issue at the national level was entry level. Whether the requirement of a baccalaureate for a registered nurse title. And I recall, and I know that those at the table that were with me at that time can recall the debates that occurred at the national level at that point, and we thought about maybe we'd call them registered associate nurses, and then there were several other different titles, and that part's history. But in our own state of Indiana, it was a very divisive issue. Again, some of you may or may not have been at some of those conventions. My reflection on that is we spent a great deal of energy on a cause that was important and right, but sometimes there's different ways to accomplish the outcomes. And I think, through this transition of time, we hope that there's at least 80% of nurses will have baccalaureates by 2020. And it's happened through the marketplace. It's happened through the performance differences. It's happened because we have research in terms of outcomes, rather than what at that point was viewed, I think, sometimes as greater or lesser. So it translated out into people, and that was very non-productive. There were some other things occurring during that time, and this gathering today, is reminiscent. As I was coming into office, we actually had the convention in Evansville, because we moved it around, and there were probably about 300 people in attendance, and some of these issues that I'm just sharing with you were hotly debated during those times. Then as we moved forward to some action, we had strategic plan. That's, I think, what every president does. We develop strategic plans, building on what's been done and learning from some of those things that either worked well or did not. But one of the highlights during my term was the transition from the executive director, Linda Shin, that Brenda has mentioned, into Naomi Patchen, who was part of the leadership executive director for a long time. And then also during my presidency, had I think, I'd like to give it all credit for myself, the wisdom, but we brought Ernie Klein, who was then treasurer of the association, and we had, again, part of that term time, the peer assistance program, where we said nurses, we need to take care of each other, and also, as I talk about the ethics element, the safety of patients, that we had a responsibility for that. Another activity that was very important, and I think we kind of again, created something that was sort of in an embryo stage. We had something that was called the Consortium of Indiana Nurses Organizations. So we were trying to pull together all the different organizations. And I think probably the participation in nursing organizations at that point in time was a little higher than it is now. So there was some force. And again, Brenda's given you a wonderful picture of the legislative efforts that were going on and actually continued and gave a good foundation as we move forward to looking at even the advanced practice role, the beginning steps along those ways. The peer assistance program, I think, is a very important one. You're all familiar with it now. It's had several ups and downs, but I think bringing Ernie was one of the outcomes that maybe wasn't necessarily the expected planned advantage, but it certainly was an advantage to have him on staff and then as our executive director when Naomi Patchen retired. The other elements that we were looking at, we had clinical sessions. Some of you may remember that. Strong emphasis in terms of that clinical practice as it relates to the safety of the patient. We also were looking closely at a clarification of the American Nurses Association and the State Nurses Association. That was one of those tensions that, again, as I look back, I think we maybe spent more time and energy trying to be sure who was supposed to do what instead of just moving forward. So lesson learned maybe in terms of some other endeavors that I have been in since that time. Membership was increasing, that was good. The state board also provided a temporary license during that period of time, and that was important because of some of the shortages and also issues relative to practice. That's probably shortcuts a little bit, but I think if we're all going to try to have the opportunity, I'm going to try to just stop at that point, other than trying to tell you what I view retrospectively, but I hope was guided by our code of ethics and looking at how the safety of patients was related to having the peer assistance program. It seemed to me that was a very important. The provision 7 that talks about the advancement of the profession through the contributions of knowledge development practice. We had standards of practice that, again, that initiation and that continued development, because at the point when I had the leadership role, there were clinical groups. We had psychiatric mental health, and we had the med-surg, had a geriatric. So, I mean, there were areas of expertise and these standards as it related to development and forwarding the profession. And then again, provision 9 of they think ethics is very obvious, that it's important for us as members of the profession to participate in our organizations. And I'm pleased to see those of you who are here, and I congratulate you for recognizing the importance of that leadership role that comes with being a nurse. And I think it's needed to such a great extent today as we move into the next era. You know, we again use this historical context, When Medicare was implemented, there were all the naysayers that we heard then about how this was just going to be the end of our country and it was not a good thing and people wouldn't have opportunities. Now we're moving into something that the Affordable Care Act, and we're hearing many of the same things. Not trying to make a judgment. Each of you have to make that decision when you work through it. But at this point, let's work together not only to move nursing forward, but to move healthcare forward in our country. Thank you.